Hi, my name is Shakita Briscoe. I'm here to perform tracheostomy suctioning on my patient, Mr. Troy Cooper. I have gathered all my supplies. I have explained the procedure to my patient, letting him know that I will be applying a sterile tubing into his tracheostomy to relieve him of the secretions that he had so he could breathe better out of his tracheostomy. I already assessed my patient and I did hear crackles in his lungs. That is why we are going to move forward with this procedure as well. I did perform hand hygiene entering the room as well before I did anything with my patient. Again, this is Troy Cooper, date of birth 8/9/78. He is a conscious patient, so this procedure will be done in semi-Fowler's position. I'll then perform hand hygiene again. I'll then drape my patient. I will drape my patient, perform more hand hygiene, put on clean gloves so I can test my equipment. I will turn on my suctioning, making sure it's at 100 and no more than 150 millimeters of mercury for an adult patient, and I do have oxygen going for my patient as well. So I will check my suctioning equipment. My suctioning is working properly. I will remove gloves, throw them in the right trash receptacle, and I will apply my mask and goggles and face shield. I also will raise my patient to a good working height. I will lower the bed rail closest to me to perform this procedure as well. Like I said, I already had my supplies, so I'm going to open up my sterile fill. I'm going to get my cardboard box without touching the inside. I'm going to place this to the side. I also do have sterile water. I will apply sterile gloves. Sorry, my sterile gloves are different. The ones that came with this was too small. I had to get more. Sorry about that. I will then my tubing. One hand will remain sterile. So it's my dominant hand. This will be the one that begins to be dirty. I will hook this up to my tubing. I will wrap this tubing around my hand. I will hyper-oxygenate my patient prior to the procedure. Remove oxygen, hyper-oxygenate my patient. No more than 3 times and no more than 30 seconds. I will then begin my suctioning on my patient. I will be going in until I meet resistance. And I will use a circular motion on the way out, applying intermittent suctioning as I'm coming out. I will not suction my patient no more than 3 times. I will then see if my patient needs more suctioning. My patient does not need any more suctioning. My patient is okay. I will then, this will wrap around my hand again. I will then use this hand. I will hyperoxygenate my patient again. Again, no more than 30 seconds. Place my oxygen. remove my, no, I will not remove my suctioning. I will perform, mouth care on my patient after I rinse my suctioning. I will perform mouth care on my patient, sorry. Then I will disconnect and remove, suction my patient mouth. I will then clean the inside of my patient's mouth with some mouth care with like a swabby that comes for mouth care for my patient. I will turn my pressures off. My oxygen is reapplied to my patient. I will, I can remove my mask and my shield. I will perform more hand hygiene, place more gloves on. I will then reassess my patient. I will oscillate my patient's lungs again. At this time, my patient does not have any bronchi like he did at the beginning of this procedure, or crackles like he did at the beginning of this procedure that warranted me to perform this procedure. I will make sure it was a patent airway we have. I will check pulsometry and vital signs. I will lower the bed back down. I will put my bed rail back up. I will put my patient in another comfortable position that he requires. I will remove the draping. I will check my patient for pain. At this time, Mr. Cooper is not in any pain. I will perform hand hygiene again and tuck my patient back in, covering back up, and I'm all done. Thank you.